Hello, and welcome to S2S Therapy TV. We're here to support your journey towards better mental health and overall well-being with our latest episodes and expert advice. Here, we dive into a variety of topics related to therapy, personal growth, and well-being. Today, we are doing a review on deinstitutionalization of mental health institutions in history. Deinstitutionalization of mental health care is the process of shifting mental health care and support from long-stay psychiatric institutions to community mental health services. The early focus was on moving individuals out of state public mental hospitals, and from 1955 to 1980, the resident population in those facilities fell from 559,000 to 154,000. Only later was there a focus on improving and expanding the range of services and supports for those now in the community, in recognition that medical treatment was insufficient to ensure community tenure. In the 1990s, whole institutions began to close in significant numbers, and there was a greater emphasis on rights that secured community integration, such as access to housing and jobs. The reforms included the conditions and service delivery within psychiatric institutions and downsizing the number of long-stay beds. This was accompanied, in parallel, by the strengthening of community-based mental health facilities to ensure that those with mental health conditions receive the psychosocial support required for their recovery and integration into society within their communities. The deinstitutionalization of mental illness was influenced by a range of factors. Here are some of the key contributors. Firstly, advancements in medications. The development of antipsychotic and antidepressant medications in the 1950s and 1960s provided more effective treatment options for managing mental illness. These medications allowed many individuals to maintain stability and function in community settings rather than requiring institutional care. Secondly, the human rights movement. The civil rights and human rights movements emphasized the need for more humane treatment of individuals, including those with mental illness. Advocates argued that large institutions often provided substandard care and that individuals with mental health conditions deserved to live in more dignified and supportive environments. The changing attitudes. There was a growing recognition of the negative impact of institutionalization on patients, including loss of autonomy, social isolation, and inhumane conditions. This shift in attitudes contributed to the push for community-based care. Also, the economic factors. The cost of maintaining large state hospitals and other institutional settings became a significant financial burden. Community-based care was seen as a more cost-effective alternative, as it could reduce the need for expensive long-term institutional stays. Next was the legal and policy changes. Legal reforms and policy changes played a crucial role. Landmark court cases, such as the 1975 O'Connor v. Donaldson decision, established that individuals with mental illness have the right to live in the community if they are not a danger to themselves or others. These legal changes reinforced the push towards deinstitutionalization. There was emergence of alternative models. New models of mental health care, including community mental health centers, supported housing, and day treatment programs, emerged as viable alternatives to institutionalization. These models offered integrated and holistic approaches to mental health care. There existed an increased awareness of mental illness. Increased awareness and understanding of mental illness, coupled with a growing emphasis on mental health as a public health issue, contributed to the shift towards community-based care. And finally, there was a focus on rehabilitation and recovery. The evolving focus on rehabilitation and recovery in mental health care shifted the emphasis from merely managing symptoms to helping individuals achieve a higher quality of life and integrate into the community. Here are some of the key benefits that arose as a result of this movement. Firstly was improved quality of life. Community-based care often allows individuals to live in more normalized and supportive environments. They can have more autonomy, make choices about their daily lives, and engage in regular activities, which can enhance their overall quality of life. Secondly was family and social support. Being in the community allows individuals to maintain and strengthen relationships with family and friends. This social support can be crucial for recovery and well-being. Thirdly was cost-effectiveness. Community-based care can be more cost-effective than institutional care. Although it requires investment in community services and supports, it can reduce the need for expensive hospitalizations and long-term institutional stays. Lastly was crisis intervention and prevention. Community-based systems can offer crisis intervention services and preventive measures that help address issues before they escalate, reducing the need for more intensive and costly interventions. However, it's important to note that successful deinstitutionalization depends on the availability of adequate community-based resources, including mental health services, housing, employment support, and social services. Without these supports, individuals may struggle and potentially face challenges such as homelessness or inadequate care. Thank you for tuning in to S2S Therapy TV. We appreciate your time and hope you found today's content valuable.